previous videos, we've talked about the hips, the pelvic bowl, gluteal musculature, and its effect upon the lumbar spine. In trying to get a release of the gluteal musculature, you're dealing with multiple layers of muscle, very deep core stability that these muscles provide can be jeopardized by having one side too tight, one side too loose, vice versa, or both sides contracted at a low level. One of my favorite ways to work on this is to use my knees. What I will do is briefly explain the anatomy, which is your sacrum primarily, and the muscular attachments. Your sacrum is a triangular shaped bone. The bottom tip down here is your tailbone. Then your sacrum is the rest of this V. It sits inside what people generally would call your SI joint. It's your sacrum and your ilia. And the position is, of course, right here. What I'm going to do as I kneel is I'm going to come in and I'm kneeling right on the outside in the soft flesh of the buttocks on either side. You're compressing gluteus maximus, gluteus medius, eventually gluteus minimus, and piriformis and the deep lateral rotators. If you're a massage therapist, the piece of goods only go on quilts, guys. You're putting a deep compression into those and saving your hands at the same time. After I've worked on the receiver in various ways, I've opened up. This is something you would build up to, not necessarily start with, but it's wonderful for people who are having low back problems. I will gently come in, and you'll see that the bulk of the pressure is on my hands and feet, and then slowly I'm going to put knee pressure right on the outside of the sacrum. You can see that I can then stand. All my body weight is going down into my knees, into the receiver's gluteals. I can feel the border of the sacrum right on the inside of my knee. If I want a little less pressure, all I have to do is come down. I can have my arms out. And I can gently walk maybe ½ inch up the side of the sacrum for a different spot, slightly different compression. Some people are going to be a little more tight towards the tailbone. Some people will be a little more tight as you go lateral and up. Remember that your knees are always pressing into soft flesh. Nothing feels bony. You can move your knees around any of this soft area. For people who have piriformis syndrome, piriformis entrapment, or they tell you they have sciatica, unless they have a clinically diagnosed degeneration of the sciatic nerve, this is wonderful. People who have pain running down their leg, who have not been diagnosed with sciatica, usually are suffering from piriformis syndrome or piriformis entrapment. It simply means that the piriformis muscle has become so tight it's pressing on the nerve that goes down their leg, their sciatic nerve. This will help relieve it. Again, it's very light on my hands, leaves me hands free. How does it feel here?
Really good.
She likes it. So, again, you're able to lean. You can always stand up. This is more pressure because my body is sinking down. You can kneel. And again, if you want to explore with a single knee, you can always change position on one side and begin to lean to the right into that spot. If you think the other side may be as tender, you can place the knee there, and then slowly you can rock side to side, providing some relief to the chronic contraction, the chronic tightness that people have in this area. If you change the alignment very lightly, of what's going on in the pelvic bowl, in the low back, goes right up the spine. Even people with upper back pain, neck issues, are often having tension in the low back as well. It's a wonderful compression. Mind your own spine. Are you collapsed? Allows you to move around and stretch as well. Deep compression through the gluteal musculature. Always in the flesh, always soft, and always on the outside of the sacrum. You never want to put excess pressure right on the tailbone. I'll see you again soon on RobertGardnerWellness.com.